We're going to finish up the skull. We're going to do the facial bones. So this is a continuation of the last video. Just decided to break it up into two because it was getting a little bit long. So let's just talk about, we've talked about all the bones that make up the cranium, the cranial vault, where your brain is. So now we're going to talk about the bones that are inside, or make up your face. Okay, so when we look at our facial bones, basically we're talking about these bones through here. Okay, so our cranial bones, we have our frontal bone, we've talked about that, the parietal bone is here, we have the temporal bone here, the sphenoid bone is actually right here, the sphenoid bone here. We talked about the ethmoid bone. You can see the ethmoid bone is also inside the eye. Remember, one of the things I want to make sure you do is go back and look inside the orbit of the eye. You need to be able to identify all the bones that make up the orbit of the eye, because there's several levels. So go back if you haven't done that yet. Make sure you can identify all those bones that make up the eye. So what we're going to talk about is all these facial bones that make up our face. So the first one we're going to talk about is the maxilla. And you have two maxilla, and this orange or kind of gold-shaped bone, this is the maxilla, here and here. So on the skull, outline one here, and here. And they join together at this little area right here. So this little divot that you have between your lips, this is kind of a leftover from when these bones came together and this part of the body kind of fused together to form the front of your face. If it doesn't close completely, we call that cleft palate. So someone that has an incomplete fusion of their maxilla is going to have a cleft palate. So what we want to do is identify several features of the maxilla. And so this is just the right maxilla. We've kind of taken it, or this one, the right one, taking it out so that you can see parts of it. And the things you're going to have to identify on the maxilla are the alveolar processes. And basically the alveolar processes are just this little ridge here and the little holes that hold the teeth in. I call them the tooth sacs. So alveolus means the sacs, so like the alveoli in your lungs or sacs or air sacs. So these little tooth holes, those are your alveolar processes. You also have the infraorbital foramen. Foramen again is a hole. Infra means below. Orbit is the cavity where your eye is. So this little infraorbital foramen is part of the maxillary bone. Again, it's just a place for a nerve or a blood vessel to come out. Trying to go down my list, see what else I need to cover. And you have the maxillary sinuses. Inside the maxilla, there's some hollowed out spaces right above your teeth. If you've ever had a cold and you're like, oh, your teeth hurt, it's because all these sinuses are inflamed, they're swollen, and there's actually nerve endings in there. So a lot of times when you get a sinus infection, a cold, your teeth will actually hurt because those sinuses are right there. And then the last feature you have to identify is the palatine process. So we've taken the skull and we've kind of turned it upside down. So we've taken the skull and turned it upside down. And so everybody goes, so when you make that sound, your tongue is hitting the top of your mouth, which we call our hard palate. That's the top of our mouth. Well, the hard palate, the palate is made up of two bones. It's made up of the maxilla, all this purple stuff. That's the maxilla. And there's another bone behind it called the palatine bone. So your hard palate is made up of two bones. So the front, the anterior 2/3, this purple part, is the palatine process of the maxilla. So again, on a test, if I ask you a question, I said, name that bone, you would say that's the maxilla. If I said, name that feature, that's the palatine process of the maxilla. See the difference? Okay. So let's move on. So that's the maxilla. So the next bone is the mandible. So the maxilla is your upper jaw. The mandible is your lower jaw. And it's not connected, it's not physically sutured into your skull. Okay, it's the only bone that's kind of hanging down, has to be connected by muscles and ligaments. So this is your mandible, and some features that you want to recognize. You've got the body, which is basically just this main big part of your mandible. You have the angle, which is what kind of gives people a sharp looking jaw. This arm here, this is called the ramus. So if you were going to pick up a mandible, if you were holding a mandible, you'd hold it by its arm or its ramus. You have two processes. You have a coronoid process and a mandibular condyle. So let's just I'm going to call this the mandibular. So you have your coronoid process and your mandibular condyle. Your mandibular condyle is going to go up inside that mandibular fossa of your temporal bone so that your jaw can rock. This little coronoid process, coronoid comes from like coronation, like you put a crown on someone, so it's just kind of pointy like a crown. This is the coronoid process. Again, it's just an attachment point. You have the alveolar process, again on your lower jaw. You've got to have those places for your teeth. So these are your alveolar processes where your teeth got little tooth sacs. You have two foramen. You have a mandibular foramen and a mental foramen. Well, hopefully from Unit 1 you remember mental is your chin. So your mental foramen are these little holes that are on the front of your chin, right here on your mandible. You turn the mandible around, got a picture of that on the back side. These are your mandibular foramen. And there's basically a hole that some nerves can come out. If you've ever been to the dentist and they try to deaden your jaw and they kind of go back there with a needle, they're trying to hit that hole, hit where that nerve comes out so they can deaden your jaw and do your dental work. So mandibular condyle, coronoid process, alveolar process of your mandible. Alright, the next facial bone is your zygomatic bone. The zygomatic bone is this blue bone here. You can see it also comes around and makes part of the orbit of the eye. It's your cheekbone. Your zygomatic bone attaches to the zygomatic process of the temporal bone to make the zygomatic arch. And that's your cheekbone. Let's see. The next one, this is kind of showing the, I'm going to do a close-up of the eye. So here's your eye, the orbit of your eye. You have frontal bone, zygomatic bone, maxilla, there's sphenoid bone, there's an ethmoid bone, there's a lacrimal bone, and there's a nasal bone. So I want you to make sure that you go in your book and make sure you can identify all those bones that make up the orbit of the eye. It's got a nice color-coded version for you to be able to study that. So that brings us to the lacrimal bone. And this is the lacrimal bone. This little green bone right here, and it's right here on the skull. And so if you were to kind of take your fingers and kind of go about right here, that's where your lacrimal bone is. And so right inside your eye, you have what's called the lacrimal duct. Not duct, duct. And so when you make tears, you have lacrimal glands. Your tear glands are actually up here on that lateral side of your orbit of your eye. They're up here. So they make tears, and tears basically will wash over your eyes down. Gravity will pull the water down. You'll blink, and that pushes the tears into your tear ducts. And the tear ducts basically go back to your pharynx, so that the tears will drain your back of your throat. That's why when you cry and you get really sad, you start getting all that watery snot in the back of your throat. Or you're making so many tears they don't drain fast enough and they spill out over your face. So your lacrimal ducts are right here, and it's right between your, it's right here. When you look at the skull, you see a little hole right there. There's a little tear duct. If you don't believe me that your lacrimal duct and your pharynx are connected, have you ever blown your nose and closed your, like that, and you felt air come out your eyes? Yeah, if not, then try it. Or I probably shouldn't. It's probably not real healthy, but I've done it enough, and I sneeze and air comes out my eyes. There's actually a YouTube video of a guy that takes popcorn and sucks it up his nose, and does like that, and the popcorn comes out his lacrimal ducts. So they are connected. Kind of creepy, but Google it if you don't believe me. Okay, let's see. So we got our nasal lacrimal duct, lacrimal bones. Next facial bone, palatine bone. We already talked about this a little bit. It makes the back part of your hard palate. So this green bone, that's the posterior 1/3. So all this right here, that's your palatine bone. Your nasal bone. The nasal bone is what makes the bridge of your nose. So this is your nasal bone. You have two of them. right here. Now the rest of your nose is not bone. What covers all this part? This is cartilage. What kind of cartilage? Hyaline cartilage. So it's going to come out and make the rest of your nose. You'd have a piece of hyaline cartilage come out and make your nose. So the nasal bones are right here. If you do a cross section inside the front of the face, you're going to find some more bones. Again, you want to make sure you think about these bones in 3D. Here's the maxilla, the palatine process. Here's the palatine bone. Here is the ethmoid bone, sphenoidal bone. This bone here is called the vomer, and it makes the bottom part of the inside of your nose. If you look inside the nose, the bottom part of the septum, that's the vomer bone. And the vomer bone is shaped like a plow, and vomer means plow. So it's a plow-shaped bone that makes the bottom half of your nasal septum inside your nose. So this will be the vomer bone. And then the last set of bones is those inferior nasal conchae, and that's just that last set of nasal turbinate bones that are on the bottom. All right, so again, I want you to remember that you do have sinuses. All these bones have some air pockets, some openings inside of them. You have a sinus inside your maxilla. You have sinuses inside of your sphenoid. You have sinuses inside of your ethmoid bone, and you have sinuses inside of your frontal bone. So just be aware, when you have a cold and you have pain, now you realize these are actually cavities inside those bones that are filled with mucous membranes, and they swell. And that's what causes pain when you have a cold. So either a frontal sinus headache or a maxillary sinus headache or your ethmoid or your sphenoidals. Alright, the last thing we're going to talk about are those fontanelles. So I told you it's a little easier to learn them if you do them at the end than at the beginning. Remember, fontanelles are just soft spots. Basically, it's a piece of membrane between the bones, or the bones haven't fused yet. So you have 6 fontanelles. Okay. You have, if you look at your lab guide, we call them the anterior, posterior, anterolateral, posterolateral. There's also the other word for anterior is frontal. The other word for posterior is occipital. For anterolateral is sphenoid, and for posterolateral is mastoid. I don't care which one you use. Sometimes it's easier for you to remember one or the other. So I'm going to tell you both. I don't care. They're both right. So this one, the one right here, this is the one you have to worry about on a child when you kind of see their pulse coming out through their scalp. If you've never seen that, look at a newborn. You can kind of see their blood vessels kind of pulsing through that soft spot. This is called the anterior or frontal. Either one, it's on the anterior, it's on that frontal plane. So near the frontal bone, so whichever one you can remember, anterior or frontal. Your posterior or occipital is back here. It's right there where that lambdoid suture is formed between your occipital bone and parietal bone. This is, again, one you need to be aware of when you lay a child down. You want to think about where that soft spot is. You can call it the posterior or occipital. By the occipital bone, it's on the back of the head, whichever one you can remember. So there's one anterior, one posterior. Now the other 4 fontanelles are on the side. You have 2 anterolateral fontanelles, also called the sphenoid fontanelles. I like the word anterolateral because that means, to me, it's toward the front and it's on the side. So anterolateral, so I can remember it. But if you can remember the sphenoid bone is right here, then you can use the word sphenoid to name that fontanelle. Remember, there's 2 of them, one on this side, one on this side. Then the last one is the posterolateral fontanelle or mastoid fontanelle. Again, it's on the posterior or back side on the side, so posterior lateral. It's also near the mastoid process. So whichever one you can remember, use it. Remember, there's one on this side and one on the other side. Okay, so that's all the stuff that has to do with the skull. So it took 2 videos to do it. So for my next video, we'll start with start doing the rest of the exoskeleton. We'll do the thorax and the vertebra. Good luck, keep up, see you next time.